Well, hi everyone. This is Dr. Sonia McGowan with Covenant Pediatric Wellness Center, and I'm here with you today to talk about PANS and PANDAS. So, if you have a kid that you're at all concerned about any sort of abrupt change in their behavior or presentation, you're in the right place. Um, so, it is right at 9 o'clock. We're going to go ahead and get started. Uh, First thing, I will definitely be able to take questions. So, I don't mind if you drop your questions while the event is happening. I will answer them as I'm able to or when the time seems right, but definitely I will answer your questions at the end. So drop them in that Q&A box on your sidebar. And so those questions will come to me and I'll monitor those and answer them. No question is off limits. So if, we're talking about PANS and PANDAS today, but if you have other questions about your kids, please feel free to put them in the Q&A box. All right. So like I mentioned, I'm the owner of Covenant Pediatric Wellness Center. So we have Covenant Wellness that has lots of services. We also have Covenant Pediatrics, and I'll talk to you about that in a second. I live in Jefferson City, Missouri. That's where my practice is, and that's where I live with my husband, Shannon. He is a CPA, recently retired. So not only do we now have an empty nest, but we have a retired person, which is great. We have Libby. She's our daughter. She lives in Kansas City. She's a musician and works for School of Rock. We also have Rowan. He is just finishing up his second year of college at Millikan University in Illinois. And he really is the reason for everything because as you can see in this picture, haircuts were not his jam when he was little. He really had a lot of sensory issues. He had a pretty severe language delay. He had a lot of behaviors that were concerning, a lot of digestive problems, skin problems. And back then, he was born in 2005. Back then, there was just very little help for families like us. And so, despite taking him literally to every person I could think of, no one was really able to help us. And so, I had worked in the field of autism for my whole career. And so I had some resources. And so I took Sydney Baker's work and I applied it to my son and he recovered. So if you don't know who Dr. Sydney Baker is, he is a pediatrician who was really at the forefront of the whole DAN and now MAPS movement to really see autism as a medical situation. Rowan never had a diagnosis of autism, but he had a lot of challenges. So now he's perfectly fine. He's in college and independent and doing great. We also have, this is Ozzy when he graduated from puppy school. He's now a giant now. He's a sheepadoodle. He's about 1.5 years old. So he keeps hubby and I pretty busy. So let's talk about Covenant. So we work primarily with complex kids and adults. So we do a lot of functional nutrition, a lot of lab testing, and we really try to look at the whole kid. We find the root cause of the problems and we correct it. We also have a pediatrician on staff. She's developing more and more experience all the time with complex kids like autism, PANS, PANDAS, etc. And then, of course, she provides standard pediatrics. We are happy to be just about the only practice in the area who will see kids whose parents have deeply held beliefs about certain things like vaccines. So we're happy to take unvaccinated kids. We also do a lot of work around oral restrictions. So tongue ties, lip ties, etc. And then we do chiropractic for all ages, but also prenatal and pediatric chiropractic as well. So we do a lot of stuff to help kids get better. So today we're talking about PANS and PANDAS. And some of the things we're going to cover. We're going to talk about what those acronyms mean, what they are, what are the symptoms of PANS, PANDAS, the diagnostic criteria, and then we're going to talk through the things that tend to trigger kids and cause this, and then the testing and intervention options. So we're going to cover all that today. So there are lots of acronyms. Most of the time you'll hear PANS, PANDAS. So PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. And PANDAS is the same, but it's specifically associated with strep. So if the trigger is strep, we call it PANDAS. And I'm going to show you a graphic here in a second about how it all fits together. You will also potentially hear it called autoimmune encephalitis. There's some controversy, some contradictions in the field about at what point do PANS and PANDAS sort of tip the scale over into autoimmune encephalitis. Um, so some people think it's kind of an advanced diagnosis of PANS and PANDAS. Some people think it's the same thing. So there's some controversy, and I don't have time to go into it. I just want you to know what those terms are in case you hear them. Very occasionally, you might hear infection-triggered autoimmune brain inflammation. You might hear childhood post-infectious encephalitis, and you may hear pediatric infection-triggered acute neuropsychiatric disorder. Okay, so lots of words, but really, I'm giving you all of the common acronyms so that when you're reading studies or articles, when you're talking to other people and you might hear those terms, I just want you to be familiar with them. All right, so let's talk about how it all fits together. So look at PANS as an umbrella term, okay? And so with PANS, you can have infectious triggers and non-infectious triggers. So if the infectious trigger is strep, we call it PANDAS. If the infectious trigger is something else, like a virus, like a bacteria that is not strep, then we call it PANS. So those are the infectious triggers. If we come down to the non-infectious triggers, we can have environmental causes, metabolic causes. So things like mold exposure, things like anesthesia can trigger PANS. So if it is a non-infectious trigger, if it's environmental, metabolic, we call it PANS. So everything is called PANS unless it is caused by strep, and then we call it PANDAS. All right, so if we look at the diagnostic criteria of PANS, it's an abrupt, acute, dramatic onset of OCD or severely restricted food intake. So, this is the diagnostic criteria, but when you're talking about real life, sometimes an abrupt, acute, or dramatic onset was overlooked. So I've worked with lots of kids who will say, yes, it was an abrupt onset, but I was able to cope. I was able to hide it from my parents. And so we can't let that abrupt, acute, dramatic piece get in the way of an accurate diagnosis. Okay. We need a concurrent presence of additional neuropsychiatric symptoms with a similarly severe acute onset of the two following categories. So also we would see things like anxiety, we see depression or emotional lability. So up and down, happy, sad, angry, unhappy. We may see developmental regression, so other behavioral problems. We'll often see a sudden deterioration in school performance. Generally, it is math and handwriting. We'll see some motor or sensory abnormalities. We may see some somatic signs and symptoms. So that might be a change in urine habits. It might be a change in sleep habits. It might be things like, so I mentioned the urine habits. It may also include bedwetting, wetting their pants, things like that. And then, of course, symptoms are not better explained by a known neurologic or medical disorder. And for PANS, there's no age requirement, so you don't necessarily have to be a child. And for PANDAS, we're generally going to see the presence of obsessive behaviors and obsessive thoughts, compulsive behaviors, and or motor or vocal tics. There is an age requirement, so we need symptoms evident between ages 3 and puberty. Acute onset and episodic. So we call this a relapsing and remitting course. So kids will get better and then they get worse. So you'll often hear those called flares, PANDAS flares. There's an association with group A strep infection and then associated with neurological abnormalities as well. All right, so let's talk about day-to-day symptoms. And what I've done for you is kind of break it out into sort of different classifications. So when we talk about sensory changes, these are some of the things you may see in your child. So sensory amplification. So everything is just suddenly bigger, louder, brighter, right? Um, we see sound sensitivities. We see sensitivities to taste, smell, and texture. So a lot of times this centers upon food. So the way food smells, the way food looks, the texture of it, the taste of it. When you've got, these sensory changes, the sensitivities and the amplification, sometimes this can really affect a child's ability to eat. And also just the ability to function, to be able to go to school and to go into public and to live around other people. One of the things kids tell me a lot is that they have misophonia. So that annoyance at the at the sound of how other people sound they eat is a really, really big deal. And so a lot of times we'll see kids who want to eat by themselves, or they just won't eat at all because they can't stand, being around other people when they eat. So again, with the sound sensitivity, but particularly hyperacusis. So suddenly their sense of hearing is very, very acute. I've seen so many kids with PANS and PANDAS, and there are a few things that have come across with multiple kids. We will hear of kids who have a fear of water, a fear of running water. We'll see kids who will say they're scared of the wind. So they don't like to hear the wind. They don't like to feel it. They don't like to see like things like flags or trees or leaves blowing in the wind. And so sometimes that goes together with a fear of being outside. So lots of kids will refuse to leave their house. They refuse to take a bath. They don't shower. They can't wash their hair. So really a lot of sensory things can influence kids a lot. We also have physical symptoms. So many kids will talk about pain. So headaches, migraines, joint pain, muscle pain. A lot of times kids will have pain that other providers will just call growing pains. And sometimes the pain just is what it is. But for kids with PANS PANDAS, it's a pretty significant thing. Another very significant physical symptom is any sort of urine issue. So changes in urine habits. It might be bedwetting. It might be just suddenly, in the middle of Walmart, they wet their pants when they were previously potty trained. So we see sometimes an increase in urgency, an increase in frequency. So anytime a parent says suddenly they're wetting the bed or suddenly they're wetting their pants every day at school, immediately I'm thinking we need to have a look at PANS and PANDAS. We'll also see loss of energy. We see sometimes the opposite, sort of a new onset of hyperactivity. So kids who can't sit still, they can't just relax and be comfortable in their bodies. We will also see a lot of eye symptoms. So dilated pupils. So kids come in and their eyes are persistently huge. Their pupils are like dinner plates, is what I say. And sometimes we'll have a new onset of odd eye movements. So sometimes kids will, gaze from the sides of their eyes. Sometimes they'll do odd blinking sorts of movements. We'll also see sleep disturbances. And sometimes this is related to pain. Sometimes it's related to anxiety, which we're going to talk about shortly. But a lot of times kids can't sleep alone. They can't be in their rooms by themselves. They can't go to sleep. They can't stay asleep. They have nightmares. They have night terrors, things like that. And then sometimes we'll even see other changes like the way a child walks. So maybe they'll go from a normal gait to maybe a wide stance gait. We've had a couple of patients who started walking kind of sideways. And so any sort of, major change in the physical presentation of a kid definitely makes me look more deeply into PANS and PANDAS. We also see compulsions and obsessions. So remember that compulsions are behaviors, obsessions are thoughts. And so some of the things that we see, some symptoms, a lot of issues around food. So sometimes they will restrict their diets, or they will restrict their diets for a variety of reasons. So sometimes it's they only want to eat at certain times and no other time is okay. Sometimes it's the type of food. So they will eat nothing that's green, or they will only eat things that are white, right? Sometimes we see food restrictions because they have certain rituals that they need to follow. They need to eat certain things in certain ways. Um, Sometimes though, it's strict rules around food in because they are having some issues around being afraid that maybe the food is contaminated. They think maybe the food is poisoned, or they are afraid that they might choke or vomit. So kids very frequently have a phobia of throwing up. And so because of that, they just don't eat. So it's rarely, any kind of eating restriction is rarely due to a body image issue. It is generally more of a compulsive, intrusive thought kind of an issue. We also see um, a lot of issues around religion. So kids will have religious compulsions. They'll have religious intrusive thoughts. So kids will say things like, why does God hate me? Why am I the worst sinner in the family? And so just a lot around religion. We also see some aggressive or self-injurious behaviors in kids. So they may aggress against parents or siblings. They may hurt themselves. Um, we also have other just rituals. So kids will, have to do a certain number of things a certain way before they can let themselves go to sleep. Or, they have to touch their bedpost a certain number of times, and their stuffed animals have to be in a certain order and a certain way. Or, they can't go to bed, or they can't get up, or they won't let themselves eat their breakfast, for example. And so lots of rituals, lots of irrational fears. And then some of the classic compulsive behavior that you see, like checking or making sure things are symmetrical. Another compulsive, anxiety-driven sort of behavior is hoarding. We see lots of hoarding behavior in kids. So often it's things like cardboard and paper that they will hide under their beds or in their closets. But sometimes it's more. Sometimes kids will hoard food. Sometimes they'll hoard toys. It's really different for every kid, but we see a hoarding component very, very frequently in our kids. And then some behavioral, or what can look like psychiatric symptoms. We see a lot of anxiety. So pretty extreme anxiety about everyday things, about new things. Particularly, we see a lot of separation anxiety with parents or grandparents. So, kid just can't stand to be apart from these people. And that really tends to bleed over into bedtime. So it makes bedtime especially difficult, because a lot of times we'll see fear and anxiety and activity level increase as bedtime gets closer. And then we'll see kids who, can't go upstairs to their room by themselves, or they can't lay down in their bed by themselves. They have to have mom, dad, or whoever it is close to them until they fall asleep. And a lot of kids are like that, right? I had to lay down with my kids for them to fall asleep. But this is extreme, right? It's absolutely extreme. Again, we'll see nightmares, night terrors. We'll see extreme mood shifts. Sometimes we'll see regressions. So we may have behavioral regressions where kids maybe start to baby talk. Maybe they start playing with the toys they played with 5 years ago. We might have a 12-year-old who, wants to play with stacking blocks, or, something that's not age appropriate. Sometimes we will see academic regressions. So suddenly kids look like they have ADD or ADHD. They've lost a lot of executive functioning skills. So that ability to sort of plan and prioritize, they've lost that. Sometimes they lose handwriting skills. Sometimes they lose their math skills. It's really common for kids to suddenly become socially awkward. They have a regression in their social skills. Um, and so it can be very impactful, not only at home in day-to-day life, but at school as well. A lot of times we'll see kids who have a loss of hygiene. So they're unwilling to take a bath, they're unwilling to shower, they're unwilling um, to wash their hair, comb their hair, cut their hair. Some of this is related to some of those anxieties and fears that we talked about, fear of running water, fear of water itself, etc. So we also see vocal and motor tics. So very commonly I'll see a throat clearing or kind of a sniff or a snort, something around the nose. Sometimes it's eye blinking, sometimes it's shoulder shrugs. So it can be different for every kid, but those are the kind of the most common ones that we see. And sometimes it's hard to differentiate, is this a vocal or motor tic, or is it allergies, or is it, something else that might be causing them to sniff, snort, clear their throat, etc. But any sort of, uncontrollable sound or movement of the body is definitely a reason to pay closer attention. All right, so here's an example. I talked about the loss of handwriting skills. So this first one on the left comes from the PANDAS network. So this on the left is the child's normal handwriting, which looks very nice. And then during a flare, you can see they lose those handwriting skills. This is a family who I've known forever with a son with PANDAS. And so on the right here, you can see beautiful penmanship. And when he's in a flare, he still has very nice handwriting, but there's kind of a compulsive need for him to just write every vowel he can think of. And of course, it doesn't matter when the page gets full, he just keeps writing on top of those words. All right, so PANS is a neuroinflammatory autoimmune encephalitis that can have multiple triggers, like we talked about. So, any child who has a new onset of symptoms, or if they're a child with a long list of diagnoses, then they really should have a workup for PANS and PANDAS. So, if a kid comes to me and they have, ADD and ODD, and they have a conduct disorder, and they have OCD, and they have a tic disorder, right? I'm immediately thinking we need to look more closely at PANS and PANDAS. It is a neurological condition that can look like a behavior disorder. So many kids have atypical seizure activity that look like bad behavior. And so really, we're getting to the point now where referral to a neurologist should be standard for most kids. This is, as you can imagine, a very commonly missed diagnosis. So over half of all kids with PANS will be misdiagnosed and mistreated for over a year. And part of the problem is that many kids have what we call subclinical infections. So they have a strep infection, for example, and they don't have a sore throat, they don't have a fever, they don't have red tonsils, they don't have a rash, right? There was no indication that the child needed medical care. And so many new strep infections cause no symptoms but are immunologically significant, meaning that they can cause an immune system response, sometimes an over response, which then triggers autoimmunity and brain inflammation. So even if a parent tells me my kid has never had a strep infection, I test them anyway if they have compelling behaviors. So we will look at strep, we will look at viral antibodies, other bacterial antibodies as well, even if the parent says they've never had an infection like that. All right, so most kids, when we talk about how this is a commonly missed diagnosis, most are misdiagnosed as having some sort of psychiatric illness, a tic disorder or Tourette's. Very frequently, they will get an OCD or a behavior disorder diagnosis. Sometimes they'll come with a PDA diagnosis, the pathological demand avoidance. Sometimes we see RAD, so the reactive attachment disorder. Sometimes it's ODD, the oppositional defiant disorder. So often practitioners have just done the best they could with what they have in terms of how that child is presenting. Most doctors are not literate about PANS and PANDAS. So when you look at individual symptoms of PANS and PANDAS in isolation, it can look psychiatric, right? It can look behavioral. It can look like a tic disorder, but you have to look deeper. When they have, many, many symptoms, we have to look at the root cause. Kids don't just suddenly, I don't know. It's complicated for sure. What we need is more doctors who are literate with PANS and PANDAS for sure. The other reason that this is often missed is that, or misdiagnosed, is that the acute window is often missed. So, like I mentioned before, sometimes kids will compensate, right? They are able to just make it, right? They're able to fake it till they make it. They're able to hide that acute onset. And so, I've had several teenagers who have said, I actively hid my symptoms. I remember one teenager, one of her compulsive behaviors was turning the bathroom light on and off, or any light switch. And so she was able to control it well enough so that after bed time, after everyone was asleep, then she could go in the bathroom, close the door, and have her compulsive behavior. So a lot of kids are really able to compensate or actively hide their symptoms. We have a question here. What about food that touches other food if you have multiple items and they touch on a plate? Yes. So ecta, that's a very common thing that we see. So just lots of food rules. There are some, neurotypical kids who just prefer their food not touch. This is, sort of next level. All right. So let's talk about triggers. By far, the most common trigger is strep. So in about 81% of cases, the cause of this is strep. So what we know is that patients with OCD, with Tourette's or other tic disorder, are more likely than other people to have had a strep infection in the prior 3 months. There's a higher risk among those with multiple strep infections over the last year. And the more strep infections a child has had, the more commonly they will have frequent relapses. And so, again, remember, patients often have a history of a strep infection that had no symptoms at all. So you cannot just go by symptoms. And the other complicating factor here is we have lots of kids who get tested frequently for strep, but it's negative when they do a rapid throat test or a culture. So sometimes we have to look deeper at things like blood or stool because strep is just kind of the devil, and it can be hard to pin down in some kids. So other triggers, the second most common is Mycoplasma pneumoniae. So this is a bacteria that gives us walking pneumonia. But again, very common. Parents will say they've never had pneumonia. They have an occasional cough or they might have an upper respiratory infection, nothing severe, but we come back with Mycoplasma antibodies that are through the roof. So we also see other bacteria like Klebsiella. We see lots of viruses. So I would say the most common virus that I see is Epstein-Barr, even in young kids. Influenza, COVID, HHV6, herpes 1 and 2. We'll see cytomegalovirus, Coxsackie A, Coxsackie B. All of these are potential triggers. And then we will see very commonly tick-borne illness. So Lyme and co-infections. So Borrelia, Babesia, Bartonella, Anaplasma, Ehrlichia, all of those are potential triggers secondary to a tick bite. Parasites, yeast, can definitely be triggers. Mycotoxins, so mold in the environment. So kids who have been exposed to, water damaged buildings or, a wet basement, for example. Our kids really are just magnets for environmental toxins. So things like metals and pesticides, but also mold. Mold is a very, very common cause of PANS. We also will see anesthesia as a metabolic trigger. So complex kids in general just don't always tend to tolerate anesthesia very well, but even neurotypical kids, it can really kind of knock them down. And so it's pretty common for us to see kids who change dramatically after being sedated. Dental things can definitely be a trigger. So many times kids will get a loose tooth, a new tooth coming in, maybe they get a tooth pulled, maybe they get braces, their wisdom teeth are coming in, and this can be an absolute trigger for PANS and PANDAS. Very, very common when parents come to me and they say, suddenly my kid's doing A, B, C, X, Y, and Z, what could be going on? And I'll say, have they recently had something dental? Did they lose a tooth? Oh yeah, they lost like 2 teeth. And suddenly they're different. So dental events can definitely be a trigger. Sinusitis and allergies often aren't the cause, but they can sure make flares happen pretty significantly. All right, so I often talk to parents about the first straw and the last straw. So we have to know what made kids vulnerable in the first place if we expect for them to get well. So often for complex kids, the first straw are things like nutrient deficiencies. So B vitamins, fatty acids, vitamin D, low cholesterol, anemia, antioxidants, minerals, right? It's very common for our kids to have pretty significant deficiencies. They also generally have fairly significant mitochondrial dysfunction. This is really a big reason for sedation being a metabolic cause. So sedation knocks out your mitochondrial function, your ability to make energy inside the cell. And when you lose that, you also lose your detox capabilities. So we've got, this medication that's impairing your mitochondria and keeping you from getting it out of your system. Intestinal dysbiosis is also really common. So we see kids with a yeast overgrowth, bacterial overgrowth, intestinal permeability, and then nervous system dysregulation. So, these are kids who don't very easily sort of go from rest and digest to fight or flight and back and forth appropriately. These are kids who are just stuck in fight or flight all the time. When you're running from a bear, you can't learn algebra or French, right? Your brain cannot go there when it's in danger. And so kids who live in fight or flight all the time can't learn, they can't heal, right? And so we've got to work on regulating and stabilizing their nervous system so that they can get well. So first straw, deficiencies, mitochondrial dysfunction, gut problems, etc. And then when we talk about the last straw, it's generally pathogens. So it's strep, it's a virus, something like that just put them over the edge. It was the last straw. They couldn't hang on. So when we do labs, you have to do labs to figure out if this is the issue. So I always start with basic things. And I tell you, one of the things that absolutely sets my hair on fire is parents will ask their primary care provider, hey, my kid's got some stuff going on. Can we get some basic labs? And generally the answer is no. And it's ridiculous because basic labs are very important. It's super common for these kids to have infectious and inflammatory markers, to have low vitamin D, to have low cholesterol, to have low iron. And these are all things that are really, really critical foundational issues that we need to know about so that we can address that first straw, right? We also go a little more advanced if it's warranted. So sometimes we look at a thyroid panel. We will often look at anti-nuclear antibodies, which are a marker for autoimmunity. We'll look at C-reactive protein, which is a marker for inflammation. And then we always look at things specific to strep. So we look at ASO and DNase B blood work titers. Sometimes we'll do a rapid throat swab. We'll do throat or rectal cultures. Sometimes we'll do a stool analysis because that will culture out what's in the intestine, and often we'll find strep there. If urinary symptoms are present, we might consider urinalysis as well. So you have to remember that cultures often give a false negative, culture or rapid swab. So we don't just do a rapid swab or a culture, it's negative, we're done. That's not the case. We keep chasing it down until multiple tests have said negative, okay? And then if we have other other things that we're trying to rule out, we'll do labs specific to that. So things like mycoplasma antibodies, we'll do viral antibodies. So for Epstein-Barr and some of those other viruses that I mentioned. Often we will do immunoglobulins with IgG subclasses, just to get an idea of how dysregulated the immune system is. I will also very frequently do a sinus culture. So especially if kids have tics that center sort of this area. So if their tic is throat clearing, snorting, sniffing, anything like that, centered around the face and throat, I will do a sinus culture. So it's a very simple collection. Just tickle the inside of the nose, send it off, and it will culture out any bacteria or fungus, mold that is growing in the sinuses. This is often a very significant finding for many kids. And because it is so dysregulating to the immune system, it's an issue where if this is present and we don't know it, it's always going to get in the way. It's going to interfere with a child getting better. Okay. We can also look at autoimmunity specifically. So I really, really love the Neural Zoomer Plus from Vibrant America. So it gives many autoimmunity markers. It will also test for strep and several viruses. So very comprehensive test, very, very helpful for us to be able to tease out, the degree of autoimmunity, exactly what pathogens are present, et cetera. We will also sometimes do the autoimmune brain panel. It was formerly called the Cunningham panel. Very good test. It's much more limited in its data than the Neural Zoomer Plus, also quite a bit more expensive, but it is something that insurance will look for eventually if this truly is a PANS or PANDAS case. And then I also look at all autoimmune possibilities. So autoimmune thyroid, I look at things like lupus or Sjogren's or anything autoimmune, because even in kids, PANS and PANDAS is an autoimmune situation. And so it really depends on the patient, how that autoimmunity expresses. So very common to see a lot of, for example, thyroid antibodies. And without necessarily thyroid findings. So when we work on reducing whatever the cause is, whether it's strep or something else, reduce those antibodies, then suddenly those other autoimmune antibodies will go away as well. All right, so realize that sometimes patients win the not great Yahtzee and they get both PANS and PANDAS diagnoses. So it just depends on what the pathogens are. So if you've got a kid with high strep antibodies and high Epstein-Barr antibodies, for example, that is PANS and PANDAS. And if you do this lab work and all the antibody levels are negative, we don't find any infection at all, then that's when we have to sort of pivot and look at the non-infectious triggers. So we look at things like, tick-borne illness, we look at mold exposure, et cetera. So again, here we go. Yeah, I got ahead of myself. So mycotoxins, heavy metals, chemical exposures like plastics, pesticides, herbicides, et cetera. And then also, looking at their history of anesthesia as well. So when we're talking about PANDAS, the incidence rate, what they say in the literature is 1 in 200 kids. Based on what my practice looks like, I would say it's drastically more than that. Average age of diagnosis is between 4 and 13, though we're seeing more adults who will come in and say, hey, I've had these symptoms since I was a little kid, and, what could be the explanation? And we do the workup and we find that they have PANS. And a lot of people think that PANS PANDAS goes together with autism. Not necessarily. I have lots and lots of neurotypical kids who have PANS PANDAS. I have lots of kids with autism who have it too. So you don't have to have them together. All right. So when we talk about treatment, the traditional treatment for PANS and PANDAS, if the pathogen is bacterial, then antibiotics make sense, right? Sometimes doctors will use corticosteroids. They'll use anti-inflammatories. One of the treatments listed in the literature is the tincture of thyme, which is absolute nonsense. We do not want to sit on this. We don't want to wait and see, because these are not kids who are going to get better on their own. They have to have intervention. And so when we talk about holistic interventions, which is sort of my jam, we look at natural anti-inflammatories, natural antihistamines. These are very powerful and important because they cool off that brain on fire situation. They stabilize immune system function. I very frequently use homeopathy. And what I choose is based on the child and the trigger. Different formats are available, which is great. So we have, liquid options, we have pellets. So it makes it easier because giving supplements and remedies to little kids can be a challenge because, things don't taste good. And, it's just tough. They can't swallow capsules, etc. We also use herbs quite a bit too, again, depending on the child and the trigger. But it's really important for you to understand that collaboration is necessary. There needs to be a whole team of people working for this kid. So we have to, if you're a provider watching this, you need referral partners. You need to have a neurologist, a pediatrician, counselors who are literate in PANS PANDAS so that you can refer. Generally what I do is that I get the labs started. We get holistic interventions started, and then I refer to neurology, or I will refer to, the appropriate outside person. And, the whole tincture of time nonsense, it really is true that we have to intervene quickly because kids can escalate fast. They don't just outgrow this. So it's important that we get right to work. And we have lots of patients here who come who just are not a full-blown PANS or PANDAS case, right? They're not to the point of any sort of extreme behavior yet. They just have some soft signs, like they're tiptoeing toward this. And these are important cases too, because we can really change a trajectory of a child when we get in there super early before these symptoms have really exploded. So remember, multiple diagnoses in a child should be a red flag to doctors, and they should absolutely consider a PANS and PANDAS workup. If they aren't familiar with PANS PANDAS, they need to refer to someone who is. So kids who come with, ADHD, autism, anxiety, ODD, OCD, behavior disorder, conduct disorder, RAD, any of those, when it's a long list of diagnoses, one after another, they absolutely need a workup for PANS and PANDAS. So let's talk about a couple of cases. We have enough time. So this child at 10 years old, neurotypical, had an acute onset after a dental procedure. So she started stuttering and stiffening her body and hallucinating at night. She started having fear attacks and seizures. She talked about pain in her body. The emergency room told the family to just ignore and redirect her behavior. She had also a fear of vomiting, a fear of choking, lots of sensory amplification. And so, this was a very extreme case. We have another gal, 15 years old, neurotypical, gifted, onset after a strep infection. So she developed social anxiety, compulsive behavior, intrusive thoughts, change in the way she walked, hallucinations. She lost her ability to read and write. And then when it came back, she started writing backwards. Very severe memory impairment. So you can see that the stories are often very similar, right? Neurotypical kids who suddenly are now compulsive and anxious and they can't sleep and they can't be alone and they, have phobias and sensory amplifications. So it's definitely more than 1 in 200, in my opinion. We have another gal, mostly neurotypical teenager, an onset after her sister had an illness. So that's also very common. Fear of vomiting, depression, aggression, can't leave the house. So if any of this makes you concerned for your child, definitely find a local provider who can do the appropriate testing. We are always taking new patients. So if we're an appropriate fit for you and close enough for you to come see us, absolutely please do that. So Ecta says, I have a patient that came through with a horrible cough for 3 months. X-ray confirmed no pneumonia. All other rapid tests were negative, but out of everything, she was positive with strep with no symptoms. Recently, the mother noticed a head tick, odd eye movements. Now that she's better without a cough, is this maybe a PANDAS case? Absolutely. Yes. Definitely dig a little bit deeper and make sure she's on the appropriate intervention for that strep, for sure. So if you want more resources, there are lots of good, trusted websites about PANDAS. The PANDAS Physician Network is really good. The Neuroimmune Foundation is excellent. Aspire.care is also very good. I also have a lot of information on my website. So the Covenant Wellness website, but also the Why Matters. There you can access podcasts and webinars. We also have a YouTube channel as well that has all of my past webinars and interviews that I've done with people. So I do a webinar every month. It's a different topic. In June, on June 6th, I'll be talking about oral restrictions. So tongue ties, lip ties, etc. And then on June 9th, I will be doing an interview with a mom who has a little girl with PANS, mold exposure, vaccine injury. So if you're interested in hearing the stories of parents who are walking this walk, then that's definitely something you'll want to watch our social media for. So we do Facebook Live, and then we put it on our YouTube channel after that. So lots of resources out there for you if you're interested, if you're worried. Definitely give us a call. You can also email my assistant, Brittany, at covenantwellness.net if you're interested in scheduling with us. So, all right, guys, we're about out of time. Thank you so much for joining me today. If you have any questions at all, this is my email address, drsonia at covenantwellness.net. Happy to answer any questions. Brittany's happy to answer any questions. And we're just so happy that you're here. And I hope it was a valuable amount of time for you. All right. We'll talk to you soon. Thank you so much. Oh, sorry. Here's one more question. Thank you so much for your introduction to PANDAS. It was helpful. Well, good, Christine. Thanks. I'm so glad you were here. If you ever have questions, just shoot me an email. All right, guys. Have a great weekend.